Hello, Adelaide. Lovely to see you guys. The temperature is dropping a little bit, but we will make sure we warm you up. Mm-hmm. So, who are we? Two doctors. My name is Alphonse Roex. Heleen is my wife. And only in 2010, as doctors, what we traditionally do, you come to see us, we listen, take a history, and then usually you write a script or we offer you a procedure. This is what doctors' training is all about. And in 2010, we found out an alternative way.
So, plant-based nutrition, or nutrition for that matter on its own, is usually not part of the medical training. So if you are surprised that your doctor has no knowledge about nutrition, and when you go to the doctor and the doctor says plant-based nutrition or vegan, that might be even dangerous, don't be surprised. And I'm not blaming that doctor, because 7 years ago we didn't know as well. So we are not blaming doctors. We are here to educate the public, and we are also educating doctors. So we go into hospitals and we are talking to to health care professionals.
How did we find out about plant-based nutrition? On CNN, on a certain day, it was clear that Bill Clinton, the former president, became a vegan. So how come? His doctor, the doctor looking after him, worked at the White House. His name was Dr. Dean Ornish. And as you all know, Bill Clinton ate a lot of hamburgers, had cardiac problems, he had bypass surgery, etc. So Dr. Dean Ornish told Bill off, you should change your lifestyle. And Bill did.
And Dr. Dean Ornish did research in heart disease and plant-based nutrition. And that was publicized even in a very prominent journal, medical journal, The Lancet, in 1991. And everyone thought around him that will change the medical field, and it didn't. Because it didn't really surface, and it's really hard to make that change in your mind, that a diet without animal products is healthier. Okay, so we are still doing that battle, but we are progressing. Also, our mission here is that we are independent. So it's not for us earning money. We are not related to any company or any organization so that we earn money with this. This is all voluntary. It's all, without any remuneration. And also we base our knowledge on solid science. Solid science, not just a case report. For instance,
you hear people say, well, my aunt Mary, she ate prosciutto, she drank black coffee, and she's 85 and still healthy. That's not evidence. It might have worked for Aunt Mary, with all respect, but we look at solid evidence based on research done with human beings. So we like to contribute because there's a lot of confusion. Today you hear this, tomorrow you read that, and most people, what do if you're confused? You stick to your habits. You don't change.
So you might have heard about plant-based nutrition and then vegan, and you might think, what is now the difference? We even talk about whole food, plant-based nutrition, and if you listen to it, you already can figure out what it might be about. Whole food, as in minimal processed food. And we are talking about fruit, vegetables, whole grains, and legumes. So all the beans, the peas, and the lentils. So what is then the difference with veganism, with vegan food? So we would like to shed a little bit of light on that.
Because for vegans, most of you guys, we respect you. It's wonderful. You came to the conclusion that you do not want to harm animals. Because according to the Vegan Society, I quote, veganism is a way of living which seeks to exclude as far as possible and practicable all forms of exploitation of and cruelty to animals for food, clothing, or any other purpose. That's the angle, the viewpoint of veganism.
So vegans want to avoid any animal usage for human beings, exploitation, which is marvelous. It's fantastic. And I think people that come from the whole food plant-based side can learn a lot about this from the vegan society. So we're talking about clothes, shoes, the leather, the skins, the feathers, everything, cosmetics, no animal components, no testing on animals. We are talking about all sorts everywhere, even in glue, that no animal products is being used. So this is really, in this world, still sometimes really difficult to achieve.
We would like to make a little comment, however. You can have the best interest of all animals at heart. However, when you don't eat healthfully, you might in fact ruin your own health on the long term. And we would like all vegans in the world to stick around to become at least 100 years and be healthy and smart.
Yeah, the thing is that we are so supporting veganism, but we would also like you to be around for a very, very long time, as Alphonse said. And if you experience some health problems, we maybe are able to shed some light on where you can maybe improve the quality of what you're eating.
So let's now focus on what our angle is as doctor, whole food, plant-based nutrition. So we recommend to eat as much as possible from the power plate. 4 components: fruit, vegetables, whole grains, and legumes. So those 4 components is, if you eat from them every day, you will be healthy. And we will let you know a little bit more about the health benefits in the long term.
It also means that because we call it whole, we don't want to have processed foods, highly processed foods. You can process minimally. You can, if you eat, for instance, tofu, that's acceptable. That's from the soybean, and that's minimally processed. But if we look at oils, for instance, this is a tricky one, because we had to get used to the fact that oils are not regarded
even vegetable oils.
Yeah, as health foods. Because if you really think about it, they are highly processed. You've got an olive, and you leave almost everything behind except for the oil that's in the olive, and you are left with 100% fat. And research has shown, otherwise I wouldn't tell you, research has shown that that's also affecting the quality and the health of our arteries, for instance. And then it's empty calories. There might be a little bit of polyphenols in oil, but then I would say eat the whole olive, and you've got 100 times more of these healthy polyphenols. And don't try to get them from a food that is 100% fat and not really dense in nutrients, but very high in calories. So minimal processed food.
So about the oil, there is a misunderstanding, because most people think whatever you put on your plate, if you pour virgin olive oil on top of it, then it becomes all of a sudden Mediterranean, and the idea is that all of a sudden it's healthy. I'm really sorry, but that's fake. That's not true. That's fake news.
So the focus of the whole food plant-based diet is on not eating animals, not eating highly processed foods, and as whole as possible.
So let's compare now, on one hand, the whole food plant-based nutrition, our focus, and the vegan diet, lifestyle on the other hand. And let's focus on what are the similarities in food-wise, and where do we have a slight difference of opinion. So no animal-based foods. That's wonderful. By the way, did you know already 2 years ago it was published that processed meat causes cancer in human beings. Eating processed meat causes cancer. It's comparable to passive smoking. Is there any person in the audience who would leave his or her child behind in a room where people have been smoking? No. Yet it's important. Our health authorities and nobody actually has warned us. So processed meat is proven to cause cancer. It's great because nobody here would still eat processed meat. If you look at meat.
And it's still being offered even, in healthcare facilities like hospitals, ham or bacon or sausages. And that is a little bit sad because you would expect when that comes out from the World Health Organization, they made that statement, then you would think hospitals would react to it and say, okay, let's at least warn people for this, better even take it away from the menu altogether.
So whole food means it as close to Mother Nature as possible. And there is a discrepancy. We also would say no added salt, sugar, or oil. So the SOS, no sugar, oil, or salt added. Because your food, the natural food, contains enough of all these components to be healthy.
So I guess most of people that are vegan are trying to eat as healthful as possible. If you are curious about where can I still improve on my diet, because I might have some health problems, high blood pressure, or I have difficulties losing weight, or I might have some problems with my joints, painful or so, then let me go over a few foods that we are talking about. French fries, for instance, perfectly vegan, not really healthy. It's, of course, fried in oil. And when you start using fried foods, carcinogens have been produced by heating that oil so high, to so high temperatures, in combination with the potatoes, it produces carcinogens. So, except for the fact that it's not even giving us a lot of nutrition, it's adding a lot of calories and unhealthy foods. We might use vegan margarines because we want to bake, and instead of using butter, we use these vegan margarines. How do we get vegan margarines? It's the oils, the vegetable oils that have been hardened. Hydrogenated oils. Hydrogenated vegetable oils produce trans fats. They are right out unhealthy. Even the World Health Organization is stating that. So don't be fooled by the fact that it's vegan. Yes, it's vegan. You're not damaging any animal. You're not contributing, but you're not, it's not in the best interest of your own health. Coca-Cola, of course, one of the other ones.
Perfectly vegan, but not healthy.
Yeah. And also when we talk about the vegan cheesecakes and that kind of thing, yummy, I do agree, but that should not be on the, a regular food. So I think you get the drift of the not that healthy food. So if you stick to a whole food plant-based diet, you are naturally eating low in fat. It's around 10 to 15% of calories come from fat. 75% of calories come from complex carbohydrates, the good carbohydrates, and not, I'm not talking about sugars, I'm not talking about white flour, the highly refined carbohydrates. So then when you stick to that whole food plant-based, you are already, looking after your health. And then your weight, if you have a problem with your weight, will come down naturally because you don't have to do portion control. You can eat as much as you want from the healthy food. So that's not a problem. And so it's not primarily a diet for weight loss, because that will happen naturally. It's a way of eating for health.
Yeah, so plant-based nutrition is very high in nutrients, which your body needs to stay healthy, to reduce the risk for chronic diseases, and it's very low in calories. So now, what are the so-called proven health benefits of whole food plant-based nutrition? As you all know, Australians, the life expectancy has increased over time, but in all honesty, most people suffer from chronic illnesses before they die. So whole food plant-based nutrition will reduce the likelihood that you pick up one of the chronic conditions, and it will be able, if you have a chronic condition, to improve it or sometimes even reverse it.
So one of those examples is heart disease. Clogging of the arteries, the coronary arteries that have to supply the heart of oxygen and nutrients, heart attacks. And Dean Ornish, for instance, and other doctors have proven that if you put people on a whole food plant-based diet, naturally about 10% in fat and low in saturated fat. Plants don't have cholesterol. We don't need to ingest cholesterol, because all the cholesterol we need, we make ourselves. The liver makes it itself.
So I'd like to explain it a little bit further. Just a few months ago, a friend of ours, the age of 42, had a heart attack. When I saw him after he had bypass surgery, he explained to me, well, I guess that's part of aging. That's not the case. Coronary artery disease, and based on atherosclerosis, as we call it, is a preventable disease. And that's what you don't hear most of the time from us, because we doctors, with all respect, what we like to do, what we're good at, what we're trained in is prescribing pills or offering you procedures. That alternative, that with plant-based nutrition, one can reverse coronary artery disease, that was for us beyond the wildest imagination.
Yeah, about a few weeks ago we were presenting in the Netherlands, and one of our co-presenters was a man. He was 75 years old. He had coronary artery disease. He nearly had a heart attack. They did all the investigations, but the narrowing of his coronary artery was in such a place and so bad that they couldn't do anything for him. And so he was told that lots of medication for the rest of his life, that kind of thing. Then he started researching himself. Lots of patients do that. And he found the doctors that promote plant-based nutrition. He stopped his heart disease and probably did already a little bit of reversal. He is now about 7 months on a plant-based diet. He increased his energy. He can walk easily many kilometers as before he couldn't. He had to stop every time. He got chest pain. He feels so much more energetic, etc. So his cholesterol came down. His blood pressure is perfect.
So if one of the #1 killers in the Western world, in the so-called rich countries, if the #1 killer can be reversed by plant-based nutrition, should that not be sufficient reason for us to adopt that lifestyle? We have more examples. Another disease, you might all have family members suffering from type 2 diabetes. Type 2 diabetes patients who adopt a whole food plant-based diet, lifestyle, the vast majority can reverse the type 2 diabetes. They can stop taking pills, sometimes even stop injecting insulin. Type 2 diabetes is raving around the world, not only in the Western countries, it's now coming to China and India as well, because they start using our Western lifestyle.
And think about it, if you go, I told you, on a whole food plant-based diet, your carbohydrate intake will go up to 70, 75, sometimes even 80%. And you might think, how is that possible with type 2 diabetes? Because people with type 2 diabetes are being told by doctors, dietitians in general, you have to restrict the carbohydrate intake. the problem is there is a misunderstanding. Because although your blood sugars go up in your blood, if you have type 2 diabetes, the problem is that the fats in the cells are too high. And that's why you become insulin resistant. That's why you can't process your glucose that well. So the high glucose is a symptom. The cause of type 2 diabetes is too much fat intake. That's why people do so well. Because, I told you, the fat is around 10% of calories. It's a low-fat diet. So that's really important news.
Another condition, I mean, we give you a few examples. Low-grade prostate cancer. Many men die with prostate cancer. And when you have a low-grade prostate cancer, that means the cancer is still limited to the prostate gland and it's not spread out in the body. Doctors don't really know what to do. Research shows that if those men are offered whole food plant-based nutrition, they have a better survival after 1, 2, and 3 years. So with food, we can influence low-grade prostate cancer.
Another condition I would like to mention is what we see nowadays very, very often is autoimmune diseases. So I'm talking about rheumatoid arthritis, multiple sclerosis, Crohn's disease, colitis. What else do we have?
Arthritis, did you mention that already?
Yeah, rheumatoid arthritis.
So
all these conditions usually improve or even get better altogether on a whole food, plant-based diet, which is really good news because these people, you know, they suffer a lot of pain and discomfort.
A lot of people start changing their lifestyle and their diet because they're overweight. What typically happens, you follow a diet for a few months, you lose weight, you go back to your old habits, and you gain weight again. When you eat plant-based, you can see you will be in the perfect body mass for the rest of your life. So it's a lifestyle choice. It's not a diet. Last but not least, there are a lot of little conditions which are quite common in the West. You hear it a lot, like heartburn, irritable bowel, constipation, hemorrhoids, cataract, and all these conditions you do better. The same story is becoming a little bit predictable and boring maybe with plant-based nutrition. So this is the powerful message we would like to bring across to you guys. A lot, health-wise, is a lot you can do. You can empower yourself to stay away from us doctors as long as possible.
Yes, and just stepping away for a little moment from the health factor, vegan people, people that eat whole food plant-based, the whole group all together, we reduce the vast majority of the animal suffering by the choices we have made. So if we look at Australia alone, Australia has about 300 abattoirs. And per year, over 500 million animals are killed every year, land animals, for human consumption. And in the dairy industry, a side effect is that up to 900,000 bobby calves every year are being killed because they are useless for the milk and dairy industry. Worldwide, look at it worldwide, every year, 70 billion land animals killed for consumption, and that's not fish. Fish alone, 1 trillion every year.
So that's something really...
Yeah, it's unimaginable.
Yeah, where we all can be proud of, that it's no longer happening on our watch here. Wonderful. Some additional benefits. When you eat meat, you still contribute to pollution, to climate change. Do you realize when you produce 1 kilogram of meat, the effect it has on the environment is comparable when you produce 24 kilos of wheat. So you can feed so many more people with wheat compared to meat. And what is important, air pollution, the total meat production, as it's called euphemistically, the total meat production is a worse contributor to pollution than all human transportation together. So all planes, all cars, all ships, and so forth. So if you don't do it for the animals, if you don't do it for your own health, my goodness, do it for Mother Earth. Now we would like to finish with a couple of questions. Heleen and I have the privilege to give presentations, and very often people ask a few questions. So I'm going to ask the questions, and Heleen is the expert. She goes to answer questions. Heleen, you know, I thought I need to eat meat, red meat, for my iron, and meat for my protein to be strong.
Yeah, here comes the question about deficiency. It's iron, it's protein, it's calcium, and so many other factors, nutritional factors. Let me say, last year, the largest American dietitian association, the Academy for Nutrition and Dietetics, it's a large association, conservative, after thorough scientific research, they concluded that a whole food plant-based diet is healthy and nutritionally adequate. Basically, we've answered all these nutritional questions.
So no fear-mongering anymore about iron, protein, and calcium. It's rubbish.
Yeah. We like to use the analogy of look at elephants, or look at the giraffes, or rhinoceros. You know, these animals thrive and are huge on a plant-based diet. So there is no problem for nutrients deficiencies. Also your bones, yes, we need calcium for the bones. There is more than enough calcium in a plant-based diet. It's in leafy greens, it's in beans, it's in grains, it's everywhere. But our gut, we are made that way that our gut decides how much we take up from these nutrients. So you don't want too much calcium because that can be harmful. So a lot of calcium supplements are not always very healthy. Even, like the iron from animals, the heme iron or iron supplements can be toxic for the body because it's high oxidative nutrients. And our gut makes the decision, I've got enough iron, I don't take up any iron from the food anymore. I need more iron, I take in more. So there can be a discrepancy of about 20, 30, 40% in uptake, depending on what we need. So it's just being clever, you know, the gut is clever, our body is really clever and knows what to take up.
Another frequently asked question is about supplements. If you go to a pharmacy or drugstore, you see supplements for almost every ailment, for every ill, a pill. So what about supplements? What supplements do we need to take if we are using whole food, plant-based, vegan, lifestyle nutrition, Heleen?
You would say, if it is such a healthy diet, you won't need any supplements. That would be true if we would be living so many years back when we were still eating from the soil, drinking from streams, and then we would get these bacteria, soil bacteria.
Producing vitamin B12.
And they produce vitamin B12 in our gut. Animals don't make vitamin B12. They also get it through these bacteria, and they still eat from the soil. We are now more hygienic. That means we don't get cholera anymore as well, so it has a good purpose. But that means that we miss out on these bacteria. That's why we need vitamin B12.
So the only supplement you would need is vitamin B12 if you eat strictly plant-based. Nothing else. So it's time for us, Heleen, to start to wrap up. I had a few more questions, but time is up.
Yeah.
So let's conclude. What is wonderful to be in an audience of people who respect animals. What is wonderful that nobody here is responsible for the dreadful treatment of animals around the globe. It's something, it's very shameful if you think about it. If you would adjust your vegan diet a little bit and minimize the highly processed food, which contains a lot of fat sometimes, a lot of sugar, a lot of salt, then you would serve your own health would benefit from that as well. And that's maybe the key message from us to you guys today.
Yeah, so a lot of people, and I didn't realize that myself, the importance of food for your health, the effect nutrition has on our health. So the statement made by many plant-based doctors is that there is nothing that can promote your health more than a whole food, plant-based diet. So I would like to conclude with some information. As you can see here, my banner, I am a Food for Life instructor for the Physicians Committee for Responsible Medicine. That's from the USA, Dr. Neil Barnard. I have been trained there, and I'm the only one at the moment in Australia. So, and then in Adelaide, so hooray for Adelaide. And I give courses. There are 5 weeks in a row, 1 night per week, and I will then teach scientifically based information about nutrition and health every night, 3 recipes as cooking demonstration with tastings. So the next one starts on the 6th of November. Yeah, so
Fullerton Community Center.
Fullerton Community Center, go online, you will find it. And the other thing is, who knows Dr. Michael Klepper from the USA? Who has heard about him?
Ah, okay, lovely.
Michael Klepper, already 30, 40 years practicing as a medical doctor with the help of plant-based nutrition. He comes over to do a tour in Australia, comes to Adelaide on the 16th of November. I've got a lot of cards spread out. Go online.
On the tables here.
Yeah, and try to find Dr. Michael Klepper. It will be at Adelaide Uni. Adelaide Uni, the
Thursday night.
Theater.
Yeah,
16th of November.
Thank you, folks.
all so much.
All the best. Live healthfully.